Will, there you go.
There's one there, Will.
I don't think I ever had you as a student, so I don't need to be
Oh, that one's fine?
Well, let's call the first meeting of the Community Advisory Council for Lake District to order for 2017. I want to welcome everyone. Do we have anybody on the telephone?
Yes. Alan, are you there?
You did.
I guess you're on mute, Alan.
So while we're waiting for her to
Sorry, I
unmute,
was muted. I just sent Paul a list of ancillary services for Christmas Valley.
He sent me this.
I did there.
All right.
Thank
Great.
you.
First off, do we have, I'd like to start off by going through and having everyone introduce themselves. It always is helpful to do that.
Do we want to start introduction from
Well, why don't we ask who's on the phone to start off?
Could you introduce yourself, Alan?
Hi, my name is Alan Flood. I'm a writer and program developer for the Black Community Health Center.
Marvelous, welcome.
My name is Arvinder Singh. I'm the chip coordinator at Lake Health District.
I'm Christine Albertson, I'm the grant writer for the Lake District.
Okay, no Lake County School District 7.
I'm Andrea Wishart with the Lake County Senior Center.
I'm Diane Clay with the Lake District Hospital Auxiliary and the Lake County Food Fair.
Ann Casbaum, Lake County Crisis Center.
Cecilia Montgomery Auxiliary. And Noni Moss with the Senior Center.
And Jamie Davis with OSU Extension Service.
Dale Pardue with Warner Mountain Medical.
I'm Charlie Twait, CEO of the hospital here.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Alana Shamulak, the Eastern Oregon Healthy Living Alliance.
Francie Winters, Lake Health District Privilege.
Jennifer Stroud, and I'm representing the Lake County Chamber of Commerce and Matt Unemployment.
Beth Hadley, Public Health.
Welcome, everyone. We miss anybody? Did you want to introduce yourself?
Sure, Robert Meredith with the Lake County Examiner. I'm just subbing for a few minutes here for Jimmy when he arrives.
Thank you, Robert, for being here.
Thank
We
you.
appreciate it. We're glad everybody could be here. I believe that our vendor has sent out a copy of the minutes. Has everyone had a chance to look at them? If you haven't, you want to take a few minutes? And after you've had a chance to have a quick look, I would entertain a motion to approve the minutes.
I moved up, we approved the minutes as written.
Thank you, Cece. Do we have a second?
I'll second.
Thank you.
Hey, Paul, I have a correction. This is Alan.
Yes,
Okay.
The grant applications are due January 31st, not 21st on the last page.
We just want them early.
Yeah.
I'm really sensitive to dates.
31st, thank you.
Great. With that noted change, it's been moved and second. All in favor, please signify by saying aye if you approve the minutes.
Aye.
Any opposed, same sign. Thank you. Next thing, Paul, do you want to talk about the election for the chair and vice chair?
I can bring it up. Thank you. It's January and all of the local community advisory councils are asked to do two things. One is hold elections and the other is to provide a list of the official members according to the Lake County Commission / Court who have been appointed. So it's time for that vote. Charlie has been chair for a while. I don't know if anybody's approached you, but you want to continue?
Nobody's approached me.
Okay.
Somebody else can do it if you'd like.
I moved with you, Charlie, as.
Yeah. Second.
Are there any other nominations? It's been moved and second to have me continue on as the chairman for Lake County Community Advisory Council. All in favor signify by saying aye.
Aye.
All those opposed? Okay,
And I can't remember if we had a vice chair, to be honest.
we did not. So actually, a vice chair, I would suggest
In the
that we
absence
appoint,
of-
in absence of me, have our vendor do
Run
that.
the meetings.
Yes.
Okay.
Is that, can I have I'll make a motion, Darwin, now that you're here.
I second that motion to make Andrew the
Vice Chair?
Uh-huh.
Thank you, Darwin. It's been moved and second to have our vendor act as our vice chair for the Community Advisory Council. All in favor, please signify by saying aye.
Aye.
Please, those that are opposed, same sign. Thank you.
That helps serve too, if you can't make the Regional Community Advisory Council that has, designated proxy, it works that he can go in your stead.
He's been going in my stead several times,
Okay.
just because I can't continue to.
Right. On the regional CAC, just remember it's Ken Kessler and whoever's chair here for Lake County.
And we made many of the meetings. I'm not sure of all. And we try to bring that information back to you. Paul, did you want to talk about the lake health providers?
Yes, this is about reducing opioid prescriptions for lower back pain. The Oregon Health Authority has determined that long-term opioid painkiller use is not effective. And they are asking the CCOs to reduce the amount of drugs that are given to somebody in terms of the dosage, and also to have them off of the drugs by 2018. So there's a tapering off of the plan and then being pain-free, or not being pain-free, but being off of opioids by 2018. And as part of that, the Eastern Oregon Coordinated Care Organization Board of Directors and their clinical advisory panel has determined that we will pay for certain alternative services to help people with pain management. And those services included chiropractic care, occupational therapy, physical therapy, acupuncture, massage therapy, and naturopathic services from a naturopathic physician. And we have a list of people that we have under contract or that we know of and are in or out of the network. And basically all we had was one person named David Ager as a chiropractor. And I don't even know if he's still around or if he is. But what I need is collective input, either to our vendor or through me. Do you know if anybody else is about, the southern part of Lake County? Alan is looking for people who may be out in Christmas Valley that are providing these services, except for, we know about the physical therapy services that the hospital would provide, or occupational therapy. What we're looking for is to be able to contract with independent people in the community around that.
We have several in the Marius building, I'll make sure that we share that information.
Several who?
Several, we have chiropractor, we have massage therapy,
Okay, good. So if
at
we,
least. There may be acupuncturist too, but I'm not.
I'm told there is one, I don't know if it's
it is okay if they come in from somewhere else. It's whether they're providing that service here so that someone on the plan could get that care in Lakeview or up in Christmas Valley. Yes,
Can I
Chris?
ask a dumb question, off of the drugs, like no painkiller prescriptions in 2018, what does that?
No. That, it's
Those who are
specific
on
to
this-
lower back pain.
Okay.
And though I said opioids work short term. I mean, when you're coming out of surgery, when you're in an injury, they don't work long term. In fact, you keep needing more and more, and the benefits aren't there. So this is specific to lower back pain. If someone were dying of cancer, there would still be all the drugs that they could need and want to keep them pain-free as best as we could. That's not, I hope I didn't make it sound like it. This is a common complaint, lower back, that just, surgeries haven't been good evidence that they work, but these alternative therapies have shown a lot of promise. And the other piece that goes with it is the mental health counseling, the cognitive behavioral therapy. We know who's here
I'll
through
share that.
what do you guys call wellness center
Yeah,
now?
wellness.
Through the wellness center, and who might be able to train. I mean,
Is
some of the community mental health programs, like up in Harney, have created pain clinics
Right.
too. I don't know whether you guys have done that.
we haven't yet, but how about the new Stanford Pain Management Program? Are they looking at that at all?
Well, it came from the HERC, which is the Health Evidence Review Commission.
Okay.
So I'm sure that that was part of their overall,
But it didn't mention it, so I'm not sure, so.
well, I wasn't on the HERC,
Oh,
which is
And
the,
you didn't say yoga either.
you know, it was part of the mix, but it did not
Make
get the funding list.
Okay.
But yes, yoga is something you would refer people to as well.
Is Jackie Robinson in Mary's building? Do you know, as far as massage therapy goes?
I don't recognize that name.
She's
Okay.
teaches.
Yeah, I don't think she
Teaches
does.
ours.
Okay.
She's the health class teacher?
Yeah.
Drew's there though.
Drew
right?
is there, Drew.
Okay.
And then
Wei Kwong, chiropractic, who also does acupressure, potentially acupuncture, right in front of the Mary's building on First Street North.
Yeah.
He does not do acupuncture.
Just acupressure. Okay. And the heating stones
Yeah.
thing.
Yeah,
Okay.
no needles.
Okay. So that.
I wasn't getting this list of names because we're not, can we funnel them to you?
Yeah.
So if there's a request sent out mail-wise, email-wise, if you can just respond back to our vendor, and then I'll get that to the appropriate folks. And Alan, if you're still on the phone, you said that you sent a provider list to me through email. I have not received it.
Yeah, I sent it to Christie and Arvinder,
Okay, thank you.
and it has a list of, I think, 5 different providers.
Would you share that here, just so people know what's happening up in the north end of the county?
Oh, sure, do you want to know the names? Is that what you'd like, or do you want me to send this to?
Yeah, just run through what, that email real quick. Is it chiropractors, massage therapists, what are they?
There's a massage therapy services, licensed masseuse, optometric physician, a naturopath, and an acupuncture person, chiropractor, dental hygienist, and there's just some information about the dental van.
Okay, thank you. So our vendor, I'll send a email to you, you can get to the group and we'll see what comes back.
Yeah.
Appreciate you guys' knowledge of the local community and what they're, that doesn't mean that those people would agree
Yeah.
to accept EOCCO plan members or the payment mechanism, but there's going to be a bigger push among private payers as well, so your regular insurances to get people off of opioids as well. And I don't even know if you've seen, there's been national commercials from the Association of Physical Therapists. Have you seen it? Talks about pain and, not to use opioids and, the numbers of deaths because of opioids in this country is high. Oregon is the worst state for opioid prescription. We give more than anybody else. So there's also some trainings coming around that I'll link you all up to if you want your clinicians to be able to attend.
Yeah, I saw one on TV about doctors, 2 doctors, about, we've been doing this, we didn't know we need to change it, stop now. It was really, I was like, wow, that's pretty cool to have that,
Yeah.
Well, it's hard. I mean,
Yeah.
people come in expecting relief from pain, and believe me, doing PT when you're in pain is more painful, but you gotta work through that, and that's where that person, in connection with somebody in mental health who can do some counseling to encourage people to continue to do it, is really what's shown to be long-term effective. So it's gonna be a challenge. And I'm sure that the docs are gonna hear it more than anybody. Just give me my pill and let me get out of here, but. That's it on that agenda item. You're up, our vendor.
Thank you, Paul. Hello, everyone. Now coming to the chip updates. Let me start with OE Health. As most of us know that the 2016 session for the dental screenings for children initiative has been completed. It got completed in December, but the turnout was a bit underwhelming. So I had a very nice meeting with Will Cahill and Susan Warner, the principal of the schools, and we all shared our concern that the numbers weren't doing too well and how we could better that. So our next plan is, so usually, I guess for the last 2 years, whenever we were doing our dental screenings, they were happening in late fall. So for 2017, we'll be having our session in late fall again, but to improve our numbers, we have decided to re-administer the dental screenings during spring of this year. And we'll be doing them again in the parent-teacher conferences in spring, and the dates are April 12th and April 13th. And speaking with Will Cahill and Susan Warner, we decided that so the reason the numbers weren't that well in last winter was because there was a miscommunication about sending the reminders out to the parents, because the consent forms we got from the parents were at an all-time high. We got close to 200 forms, but there was a problem with reminding them, and that's why most of them didn't show up. And I guess that was during the time when I was transitioning into the chip coordinator position, so I guess there was no coordinator to look over it. So for spring, I'll look into it. So one of our plans is to send out the reminders with the parent-teacher conference notes. That will be on March 15th, a good month ahead. And also I'm planning to do a lot of advertising over media such as radio stations, local TV. We'll also use the Lakeview Examiner. And yeah, I'm confident that, because when I did speak to the parents a few days before the dental screenings, they were not aware that the screenings were happening then, but they were looking forward to it. So they were like, oh, if we knew, we would have made plans to show up. So I'll see to it that they have been reminded way in advance, and I'm positive that the numbers should be better. And once if the spring dental screening program is a success, we'll focus on the official 2017 dental screening initiative program, and if the spring program goes well, I think we can change the time from the parent-teacher conferences to the regular school hours.
We had a great meeting with our vendor, and we're really going to focus really hard, collaborative effort between, the schools and the city. So,
It'll help to have a warm body consistently in there.
yeah, we're looking forward to that too.
Now coming to the youth health advocates.
Well, just one thing on the oral health program. It does lead to the dental sealants, correct?
Yes, so it's dental screenings, and then you also have the option of fluoride varnishes, and then dental sealants.
Okay. So the incentive measure for the EOCCO, the Eastern Oregon Coordinated Care Association, is the placement of the dental sealants. And one of the goofy things is, once you seal the kid, they're not part of the denominator anymore. So if we're going to get the kids and the parents who are most easy and acceptable for this stuff, and then the next year, those folks get to the side, and then you're asked to get the ones that didn't do it. That becomes your denominator. So out of those 100 that didn't do it, then you've got to get it. So it keeps getting harder for Advantage Dental. It's just a strange, I mean, you think you seal them, you should get credit for it and continue to get credit for it, but it doesn't work that way. So
They don't get resealed every year?
no, they're good for.
No, they're good for 5 years once.
Do they come back on the list after 5 years?
They could, but by the time, so this is a school children initiative, so.
Yeah, it's the first and then the permanents. So those age groups is when it starts. So you guys want to come up to the table? We can make room. Just slide.
Let's
Stretch out, you know.
Ah.
They got plenty of room.
Yeah.
Well, let's slide down.
Yeah.
That way we'll force them to do it.
Doing good.
I know, sorry.
So forlorn.
I'm messing everything up.
Thank you, everyone, on that last one.
Here you go, Darrell.
Where are you going?
I just, all of a sudden,
That's your, you feel like hard.
I remember we had a discussion of.
I know. Yeah, good. Yeah, it's me and Francie said, I'll fix it.
Have you heard anything about?
no, but that is how it is.
Coming to the youth health advocates update. So in December, we had planned to conduct classes in North Lake and Lakeview, but we weren't able to as there were too many holidays and a couple of our advocates weren't present. They had some family emergencies. So we planned on conducting 2 classes in January and completing the program. So one of the classes have already been conducted in Lakeview, and the other class has been, we have booked January 24th for the next class. So Lakeview is good. For North Lake, they were having some problems scheduling free time for the classes. I think they are still left with 2 more classes. Next week is going to be one of the classes, and I've been forcing them to find another slot before January 27th. Because we have to be teaching the same kids, the youth health advocates classes, and end of January, I guess even for the health classes, the will change. It's not the end of the school year, but that's how it works. Semester, yeah, that's the right term. Thank you, Francie. And so that's the update with the youth health advocates. Do you want to add anything else? For the final class, we'll be also doing evaluatory survey.
Yes, and so for the last classes are, they'll conduct a program evaluation, and so it's important that the youth health advocates were teaching the same youth, and we're rounding against the push to the end of the semester to get that 4th class in, so
Yeah.
I'm glad to hear that's going to work out, fingers crossed, there's no more, snow days or anything happens. But I think we'll get some great data to share back to this group too, from that.
Yeah. Thank you, Jamie. Coming to the food court updates, Rochelle, can you give some insight?
Yeah, sure. So, yeah, not a ton to report, it's probably pretty brief. I think I was off 2 weeks, I was off for a few weeks at the holidays, so haven't been working a ton since our last meeting, but we did have our first taste test in the cafeteria. Happy to report that it went well. It was this past Tuesday, we did carrot chips. I oversalted them, but the kids seemed to be okay with it. And yeah, we did a little dot survey, so we were trying to get feedback, nothing too scientific. But yeah, I got about 87 participants in the DOT survey, so interesting to say, did only 87 try it? Did we miss some for the survey, But out of those, the majority said they loved it. They had 3 choices for the survey. It was tried it, liked it, loved it. So we had a slight majority for the love it, which was encouraging, although some for the try it and like it as well. And so those will continue monthly throughout the school year. And I was just speaking with Jessica Morton over at Union, and she's happy to do a taste test there as well, so that'll be happening on January 31st. We'll do something kale related. So yeah, so it's been good getting from, I've been in the classroom primarily, so it's been good to finally kind of engage with the cafeteria spaces and trying to, because it was really interesting. During the taste test, I was there standing at the lunch line at 80 Hay with the carrot chips, and my students were, I can't put a number to it, but 1,000 times more likely to take, the students that I had taught were so much more likely to take a taste than the students who didn't know me and didn't know what was going on with the food court or whatnot. So it was interesting to see the kind of food court model at work of you need the lessons in the classroom, you need the intervention in the cafeteria, you need all these things. So yeah, other than that, the grant materials, so the hydroponic kits, the terrariums, the root view boxes and composting kits have been ordered, so they're on their way, so that's exciting. So hopefully get those in the classrooms early February. And I've added 1 class, so slight expansion from the fall semester. I added a kindergarten class at Fremont, so yeah, things are going.
Are you taking any wagers on whether more kids will like or not like kale? Because I'd like to make a bet.
Kale chips are really good though. You can make kale chips, they're
Yeah.
awesome.
Oh, and that's probably, I honestly, that's likely what we're gonna end up doing.
Yeah.
I can't, I was thinking maybe like kale pesto or something, but we might just do kale chips. I don't know, yeah, I don't know.
We'll talk.
We'll see, yeah.
So have you conducted a kindergarten class yet?
Yeah, well, I teach the K through first class at Union.
How's that working out?
It's good. I think sometimes I get a little bit too intellectual. Or, yeah, you gotta really keep it down at a certain level, but it's been fun. We did the compost container out there. Kids really liked it, so yeah.
So you're teaching more classes a week now?
I've added one more, but also two of my 4th grade classes both opted to have an hour-long lesson versus a half hour, so that was kind of encouraging, very nice of them. Yeah.
Your after-school program?
Yeah. Oh, and me and Samra Roofner at OSU Extension are Samra. Yeah, we are working together on a
She works with me.
Okay.
after school cooking club. We're gonna have a little pilot in February, mid-February. But yeah, just have a little like cooking demonstration or hands-on cooking lesson, and then a little bit of nutritional educational facts. Not too much of that since it is an after-school enrichment type program. We don't want to get too no homework will be involved. But yeah, we'll do a 3-day long, hour and a half each day sort of session, and hopefully that'll continue in the future as an after-school club. But we're gonna see how it goes for the first time in February.
Which age group is that?
It'll be 3rd grade, or second,
Second,
grade.
third, second, third.
Second and third, yeah.
Second what?
And we are also working on a legislator visit, and I got a go-ahead from Bill Kagan and Susan Warner for us to conduct that visit, so, but it won't happen before a month, if we are lucky.
Yeah, we're gonna have to contact them and see what they're.
Yes, so we have to choose the legislators, then we need to ask if they can make it, and then we have to, yeah.
Yeah, well, it'll be our Lake County representative, but I think they're gonna be pretty busy here in about a week or two. Yeah, so we'll see
Yeah,
what their availability is.
something to look forward to. Thank you, Rochelle.
Yeah, sure.
And coming to the grants,
Sorry not to cough through it. Since I wasn't here in December, I wanted to touch base with everyone about the Okey grant that we got, and the Lake County Gatekeepers program that we're gonna launch. So the idea of Gatekeepers is to train average Joe Schmo community members, people like me, red flags to look out for, watching out for your elderly neighbors. It's good in banks that they're aware of Mrs. So-and-so, things aren't looking right, and it's just a way for our communities to keep an eye out for one another. Our trainings, the way we pitched it and what we got the grant for, we're going to host one in each of the 8 communities in Lake County. And so in addition to training gatekeepers, which I'm telling all of you, so you'll tell your friends and we can maybe get as many people as we can trained for these things. In addition to being gatekeepers and knowing the red flags to look out for and knowing a number to call if it looks like someone might need help. We want these people to also be really patient navigators, so we're hoping that we can get all these people who have services that might touch seniors to attend these meetings as well. So we'll have the senior center there, make people aware of countywide transportation and of the Meals on Wheels and of the congregate meals. Mental health can be there. Anybody who has any kind of service that might touch seniors, so that these community members that we're training more, trained professionals to know all these things. If their neighbor is saying, gosh, I wish I could get to somewhere, then they can be like, oh, well, there's the bus and they can come pick you up. So that we have more people who are aware of all of these services and just know a way to take care of one another. Francie and I should say mostly Francie, I mean, we should let you talk about the grant proposal that we're working on to launch. I'm going to talk a little bit about Project Wild and just in a nutshell what that looks like.
We could, if that's okay.
Just a brief rundown of what it is.
Okay, so, we named it, Outback Wild, because we're working on this Outback that you haven't introduced, but the Outback concept that Beth brought up a couple of meetings ago. And we wanted to expand youth with their connection to the outdoors. And Project Wild has some really awesome programs for that, and I've trained people in it before, and we've used it other places, and they've done the research to find it as a conservative model research-based program. And if we could train, the grant would allow us to train facilitators around the district, either in after-school or club organizations or in the schools. The program, the young one, Growing Up Wild, goes through preschool through age 7, and correlates exactly with Head Start. But so there's a lot of really easy to work up lessons, and if we put kids at the major schools, we can encourage the working of this into curriculum if possible. Or, we can also bring it into the classrooms. We can have it at fairs, at festivals, anything like that, to engage the community and draw them into our booth, any of our booths, and we've talked to OSU Extension and a number of other partners. So there's a whole piece about expanding the outdoor education, and food courts in here too, throughout the different areas in the county. Then we thought, okay, well, what about our adult population and our seniors, people that aren't connected to the school? We still want to get them outdoors. So we came up with the idea of doing mini bee butterfly gardens. It looks like Forest Service and maybe BLM are on board to, we're working on creating a workshop that would educate people about non-invasive and using regional plants that are going to grow here and thrive, that are going to draw in the bees and the butterflies, and everybody knows the bees are struggling, and it's important that we keep them.
Yeah.
But it's also beautification. So we're talking to the different pieces of the county and the city and SCOED and about that, and just getting different people to say yes, this would be great. We would love to do that. We thought it would be cool to do the meridians between the sidewalks and the streets, but that's just way too big a project. So they can put them anywhere they want. But the idea was to get people to engage in activities that helped aid their health, but through taking action themselves, maybe there would be a connection to I feel better, I can take action for myself, so maybe I should continue doing this kind of thing. And we would get a piece where they would connect to taking action for themselves, for their own health, and a wider picture. You're going to take action for the bees, you're going to take action for your community. Can we connect the dots? And so, anyway, did I get it? Yeah, that's kind of it. It's really got a lot of fun, cool things, but different pieces. But that's it in a nutshell.
And also, it just seems a shame that we live, and it's going to be true no matter where you live, that the kids are going to be on their cell phones and they're going to watch a ton of TV or whatever, but we live here. Let's get them to play outside. Other grants.
Who's the funding source on that?
Right now, we changed it. So we're looking at the Reeser Family Grant right now.
We're going to start with Research and see. This is such a big project. I think it's going to take a couple of different sources. So piece one, start with Research, and then maybe try Dunes, and then maybe try OCF. We'll just kind of see where we go and keep adding pieces to make this project as big as we kind of envisioned it.
Well, in the process
It's
of,
gonna be OHLA.
no,
system-wide. But
in the
that's
process of
a good-
looking at the two grants, the EOCCO and this one, we kind of come up with what is the underlying thing that is driving this? If you have independent folk, and they're staunchly independent, but we don't want to take care of ourselves, so that we're going to wait until we're so sick that they bury us with our boots on. That's not okay. So why is there a mismatch between I'm fiercely independent and yet I'm not taking preventative care to take it? And so we decided that's what we need to look at. We need to find a way to change that social norm. And that's kind of what we came up with. So we're kind of excited about it.
The other one, well, there are two more that I'm working on right now. Kelsey of the clinic and I are working on looking at something for opioid addiction. Cardinal Health Foundation has a grant out right now that's specifically aimed at reducing the number of painkillers that providers prescribe. So Kelsey and I are looking at that, and I'm probably going to touch base with you. It's in the very early stages. We have no program right now. There's this grant opportunity out there that we're going to look at and see, go after it. The other one, just so everybody knows what's going on. So we have a good drug treatment court in Lake County. It's been going for almost 2 years, it'll be 2 years in April. And there are so many different partners involved. And we only have, we have 16 people going through the program right now. The max is really 15, and in large part it's because the one drug and alcohol counselor who's doing all of these assessments, we have one, Susie McDarrell, and we want Susie's head to not explode, and we want to expand drug courts so that we can serve more people. So there is a federal grant out that I'm working with Jake Greer in the county, and we're gonna see if we can get some federal dollars so that we can double the capacity of drug treatment. So just so you know that one's coming down the pipe. Just let me do it. That's it until we get to the other one.
Well, thank you, Christy and Nancy.
Sorry for the.
That's fine.
So coming to the EOCCO incentive measures, we had planned to come up with a budget by January 12th. The deadline is January 31st for us to submit our report. And we decided to, all the 3 incentive measures that we decided upon in our last CHIP meeting, which are contraception, developmental screening, and HbA1c core control, that is diabetes. We decided to put all of them under one umbrella, which we are calling Outback Strong, which is a brainchild of Christy. And can you give us a
Well, I can't take
brief
total
summary?
credit. It really started with Beth. So yeah, these 3 measures are just so wildly different that we needed one kind of cohesive narrative to pull everything together. And thinking about what Francie just talked about with this idea that this is Lake County, and by golly, we are a bunch of strong, independent people. Our hands are calloused and we're sweaty and we don't whine about anything. That's just not the way it's done here. But trying to change that idea and get them to see, get all of us, I shouldn't say them, because I'm right there with them. My foot's got me falling off before I go see a doctor about it. Changing that perspective so that doing things like taking your kids in for their developmental screenings, making sure that if you don't want to get pregnant, that you know all of your options as far as contraceptions go, or that you are getting your prenatal care, getting kind of changing the norm so that prevention is part of the idea of strength. It's where we came up with Outback Strong. And the Outback piece is, of course, because they've been in marketing. This is Oregon's Outback for however many years now. And North Lake County has really bought into that, is what I'm told. They're kind of the gateway to that. So that's a perfect way to tie in both pieces of the county. And strong is a better word than health. Nobody wants to be told to be healthy, especially in the county. I don't want to be told to be healthy. So we're envisioning this, we're using it as a way to address these specific incentive measures, but really what the hope is, and Beth is the first one who pitched this, that this is a broader campaign that public health can buy into, that Warner Mountain can buy into, that Lake Health Clinic and the hospital can buy into, that this is, that this is a broader campaign that maybe the chamber and the Tour de Outback, that is something that can be implemented, that this is a broader campaign that we can get the whole. And I gave enough for everybody to have one. This is kind of an example of how marketing might look like for these specific incentive measures. But anyway, just some ideas. And so we kind of are envisioning as part of this, what we'd asked for these dollars is a way to just launch this campaign in general with posters and flyers, t-shirts, and whatever we need to promote this idea of Outback Strong. I don't think the schools are having it all. I don't know. This is like countywide, something that's bigger than all of us.
We'll get some more for it.
Yeah, and again, emphasize that these are rough, we don't have a photo picture, and I haven't had Spanish since high school.
Thank
So
you.
if I had that flyer, I have no idea about Spanish.
There's these 2, and that'll make 4.
Thank you. I love my screen reading. It's so happy.
Christy and Beth, I think this is a lot of fun, and I can see us like taglining our strong people program.
Yeah,
that we
exactly.
have,
That
like,
stuff.
this. So I can totally get on board, yeah.
Give me one.
I think it's cute. My favorite photo though is.
I just think this is so.
Tom, how are you, man? Good. I think it's better to have a girl than a boy.
Yeah, I really like it. Yeah, that's cool.
Yeah, so this is kind of the framework that we're using to pitch this to, well, to you guys, but also to the people who are gonna give us money. Also, can we all please just marvel at how nice our vendors have been?
So you're in charge.
Go for it. So we've kind of started, based on the conversations that we've had so far, we just tried to start the budget. And I'll be the first to say, my math and the budgeting is not my strong point, so I'm hoping we can all kind of put together and what our public health needs, what the clinic needs, what all of our needs are, what Ohio needs up in Christmas Valley. We can put all these things together and make sure that everybody is asking for what they need, and we have just shy of $33,000 total to work with.
Yeah, you can blame your math on the calculator. So coming to the diabetes incentive measure, as we had discussed in our last SHIP meetings, we were planning to go ahead with this Living Well program that is being pioneered by Clement County Council of Aging. And
Stanford University time
yeah, Stanford University. So for the program, we need 2 facilitators. Francine is going to be one of the facilitators, and the other facilitator, we spoke with Juanita, who's the clinical director, and she gave us, her name is Tanya Christie. So she's going to be our second facilitator who's going to, and we are going to do the Living Well program where we expect the diabetes incentive measures go up. So for the facilitator 2, as Francine has already been a certified facilitator before, she'll probably need a recertification. So the budget is going to be different for her and probably not as much. So for the second facilitator, for her, we need for her to be certified, and for the certification there are 2 4-day trainings. So we added 4 nights and we added $800. That'll
$100 for
$100.
Is that reasonable? I have no idea.
Depends on where you are.
Final Falls.
Yeah.
So we checked the average for Oregon was $80, but I and Christy both have had experiences where it costs us $100. So, because I get to gauge the prices. So $800 for the facilitator's stay for the training, and for the food,
That was,
we did $400, and
we
I
figured
guess
8 days and it's $50 a day is what the hospital pays, so if it's a hospital employee, then that's
that's hospital
doing
rate.
that.
And then for the year 2017, the mileage value is 53.5. And the training will be held at Skylakes, which is like 100 miles. So we multiplied by 4, and so this is the number we got just for the certification of the facility, how much it will take. This is for the facilitator 1, that's going to be Francie, and we still have to hear from Skylakes about, because we don't have an idea of how, you definitely won't be needing 2 4-day classes, training classes, so yeah, it might be just online.
I don't know.
So then we don't, so that's the portion we'll find out in a couple of days. Then we decided on, so for the classes for the Living Well program, for the attendees, we have 6-week classes. We have a class per week, and the class is going to be 2.5 hours. So we decided if our attendees attend all the classes, we will give them a $100 voucher. And for the class to be conducted, we need to have a minimum of 8 attendees, 8 participants. If it's not 8, we won't be able to conduct a class. Yes,
But what
Nancy?
if you have more than 8? There's that too.
So you didn't budget for more than your minimum?
Yeah.
So, yeah, we are gonna come to that. So we have some extra dollars where, because, and we decided on 4 sessions because we were thinking we'll conduct 2 sessions in Lakeview and 2 sessions in North Lake.
That's all.
Yeah.
What about Paisley or, we went over
Yeah.
to Silver Lake, or we went to Plage Del?
So for the sessions, we decided they will have to come to our venue for the sessions, and for the people who the venue is not accessible, we thought we could probably teach them over telehealth equipment. Because at Lapine, they have the equipment set up and they were like, we can get, and they also have, we were in talks with Alan Flood, who's a grant writer at Lapine, and he said they have the equipment and they have one person who will supervise for the participants who will be there for the training. So that's the idea we have up till now, that we have, so in Lakeview we have options of several venues. We have places which we can rent, which is like is it the Presbyterian? Yeah, I have a hard time pronouncing that. The church has a room and also a kitchen, which they will, I guess, if you just want to rent the room, it's $25. If you want to rent it with the kitchen, it's $75 in total.
Do you need the kitchen for the class?
No, when he's thinking about support groups, later, we talk about healthy living essentially.
And we also have venues in the hospital or
And it's
it's a
more
bit tight.
when you
Yeah.
have space.
So we also have space in the Maris building. So, and so we decided we'll have 2 sessions in Lakeview, 2 in North Lake. We will encourage people to make it to the venue, or otherwise we'll give them an option of through visual aid or video conferencing, they can join in.
Does the law allow that?
Yeah, I
They
didn't,
allow, apparently they allow
Oh.
this guy kind of, if they can see the visual, they wouldn't allow
Real
all.
time.
okay.
Yeah.
Yeah, North Lake Clinic has the same equipment under the same model under that Gobi USDA, so there should be no problem connecting.
That was part of, sorry, can I jump ahead and
Yeah.
ask Lapine? So that's part of, so the Christmas Valley Clinic is part of the Lapine Community Health Clinics, and they have 5 total, I think. And so that's what they're set up for, so someone can be teaching these classes in Lapine, and they can, the people in Christmas Valley can do the telehealth version. But it's really impersonal to be there and just stare at a TV. So part of what the budgeting for down for the Lapine Clinic is to have a part-time person who's there who can bring people, hang up posters, and so that's part of it. And someone who's there so that there's a real live human being there. And to troubleshoot and help us, we have another snow apocalypse and we need someone to help with equipment, someone who can be there for some of those issues.
And after we are done with our 6-week workshop, we decided on forming a support group and making them meet every week for 8 weeks. And for the support group, we added so out of the 8 classes the support groups will meet, I, Francie and Krishni, we decided 5 of them, we will probably meet in a place like a church where there's also a kitchen where they can cook food and I guess the discussion of healthy food.
Yeah.
So that's the budget we came up to for the 5 classes, and then for the remaining, so the total 8 classes are divided into cooking and snacks. So we are gonna have, so for the 8 support group classes, 3 classes are gonna be for the cooking. 2, we decided we just provide snacks for them, and the remaining 3 classes will be up to the participants in the support group, how they want to go about it. Do they want to cook, or they want to discuss, or they want to go somewhere else for their
Go to the walking club.
support group activities.
Something.
We thought we'd organize it so that they took and tried out the strong
Yeah.
people and the walking club, and like that. We organized that we let them have a little sampler of what else was going on as ours was petering out.
Absolutely, I think we can do that. From someone who's ran these programs, a couple of things to consider is, we were really encouraged to provide snacks during the activity, so I don't know if that is something we would budget for. It's not something you need to use the kitchen for, but to have like coffee and healthy snacks.
During the living well class.
During the actual sessions
Okay.
itself, was important.
Good.
As someone who's also led these classes too, the idea of doing them via distance and not having someone to facilitate that discussion in person, like I think if you had a remote facilitator with that group, it would be fairly disenfranchised to me, it feels like. But once again, population wise, I tried to offer it in Paisley. The demographics of Paisley show that this should be a huge success, but we only had one person registered. However, we have an active group of strong people right now there, and we might have a captive audience, so I just want to consider, we could see if I could gauge their level of interest before you start planning a program there to know if there would be enough people to make it work. Just a thought.
Good. And again, we have this closed loop referral system that should be coming in that would hopefully have their physicians, their providers, referring them into the program. So that might help.
Yeah, Charlie talked about that, right, that if it's like a prescription, then you should need to go do this, that would be helpful.
So the total for Lakeview is coming up to $6,700. We still need to add in the cost it would be for transportation of Francie, for getting recertified, and the food expenses. And just a couple of minutes before the CHIP meeting today, Alan Flood from the Vine Clinic sent us the budget required for the same, and their budget comes up to $2,372. And we have total of $33,000 from the EOCCO. And first we decided to divide, because we have 3 incentive measures, we wanted to divide the money to $11,000 for each incentive measure. But now we have decided first we'll work on the 3 incentive measures, and then we will do a bulk advertising for each incentive measure. So probably we don't have up to $11,000 for each incentive measure.
We'll need to add snacks for those, the 6 weeks, the 4 sessions of 6 weeks, that's good, we should have snacks.
I was just gonna say, I don't know if you guys need any like help or want any help, but if you want help with like recipe planning or like snack planning or anything like that. More than happy.
So that in-kind contribution, or like that's one where you would just need that little form at the back.
Yeah.
It says, so that they see another organization.
I like that.
Right.
So do we want to discuss the diabetes incentive measure? Because
Is there anything, I mean, what else, so snacks for the classes, but what else are we missing? And is there anything specific to, I mean, if you guys are doing, or public health, I don't know, is there anything else we need?
I think the prescriptive service type thing to the class is a great idea.
You just want to make sure that your clinicians know what the classes entail. They don't want their patients being told something different than what they tell them. And that's what we did when we did research on referral mechanisms to community-based programs. That's what they tell us. So once they're convinced that it's evidence-based, that people don't go off the curriculum.
Can't do that.
I know.
Yeah.
But I mean, those are the reasons why they're hesitant to refer to things that they don't, plus not everybody, a lot of us fit under the bell curve. But there are certain individual health issues that are complicated by multiple diseases that the clinicians are concerned about. So just make sure that they understand what living well really is.
One thing also is there's participant workbooks. Are those still?
Sky Lakes will pay for those.
Awesome.
Is that included in this?
Sky Lakes will pay for them.
And we don't have to pay
No.
Sky Lakes for it?
No.
So
And there's
that you
a
should call an
DVD
in-kind and have that in your,
Good.
as an in-kind contribution.
Yeah. And they were paid for there's a large, like, insurance waiver kind of a thing that pay $500 for each class or something like that. They're paying for that on their grant. They're also paying for the actual training. We're paying for the mileage and stuff, but they're paying for the actual training and my refresher. So it was that's a big chunk of help for us.
For the developmental screening incentive measure, so we did a bit of research. We found out in 2014, in Lakeview, we had 66 births. Then we had 70 births in 2015, and in 2016, we had 55 births. So we took an average of 70 kids, and because it's a 0 to 36 month developmental screening, even though we'll have to report within a year, but so we multiplied by 3 years and we got this number. So the clinic at Lakeview and the public health department have a collaboration where the developmental screenings that happen in public health will be referred to a provider in Lakeview so as to capture, because otherwise we can't capture the number and we can't improve our incentive measures. And if I'm not mistaken, Christy, the Warner Mountain Clinic wanted to work on their own.
Yeah, and if their providers do
Yeah.
theirs.
They do,
Yeah.
Christy and I ran some reports the other day, I thought we were at like 90%, we were at 87%, so we missed an occasional one, but I was gonna do some more research on that, because it might be like 4 months, and there might not be an ASQ, so I'll have to look at those a little more, but we wanna do them in-house, because those are sent to the patient, done in-house, reviewed at the well-child check, there's not a month that goes along in between there.
Yeah.
It works well for us, so we wanna keep doing it that way.
Yeah, that's the challenge I guess we'll be facing in public health if we need to make an appointment within the month, because that's an EOCCO requirement, otherwise the number doesn't get captured.
Well, and it changes, you know, those little ones, they change so much, if you're going from 4 months to a 6 month ASQ,
Yeah.
the information on them changes.
Is it 30 days or 60 days? 30, okay.
Which makes sense, but if you guys call at the time when they're doing the ASQs and get them in.
Yeah, so the procedure we have that we're planning to use is to, as soon as the ASQ is completed, it'll be faxed to that child's provider, and then we'll email Anita, let her know that it's been sent to the provider, so it doesn't get buried somewhere, and that she will facilitate that getting scheduled. That's how it, so we will see how that goes.
And Lapine Clinic, with their immunizations and developmental screening program, they have a diaper program where they provide a $10 gift certificate for diapers to parents who show up for the developmental screening. And so what we had decided was, so $10, instead of $10, we decided $25. We thought we'd include $10 of diapers and $15 of baby food or
Travel.
we are still travel. We can also give them
As a gas card.
gas card, yeah. So we multiplied and we thought this will be, because in Lakeview we are there, for example, we're taking 70 births in the coming year. So we thought this will be the total.
Yeah, we went high, I should say, I mean, we know that's not the average, but we're gonna have a bunch of snow days, we just are. So we went high.
But I don't think that, because for each of those children, you're gonna do more than one, you're gonna do several screenings. 2 months, 4 months, 6 months, a year, 18 months.
So that's a
And
question
then
of what happened.
2 years, and
You
then
only
you
need
need 2
one,
and then
right?
3.
So now
One.
EOCCO requires,
Yeah.
EOCCO just wants one screening to be done, but we can,
But you do encourage them to do all of those, right? And come in at 2 and at 4 and however many.
Yes.
So are they gonna go, oh gee, but last time I got diaper stuff,
So we
and now
should
I'm
maybe
not,
build
is that
for all of those?
gonna be?
How many are there? How many?
Well, if we do them at immunizations, it's 2, 4, 6 a year and 18 months. So each child would be 5.
So that times 5, right?
so
Well,
this
that's,
times 5?
and that's for public health, but then they go, Taylor, do you guys do it again at 2 if they've done it at 18 months? Would you guys do it at 2 also?
Yeah, we have an ASQ for 18 months.
So you have 18 and then 2 years and then 3 years? After 2, do you go to 3? Okay.
So that way we'd have to reduce this number then. we can't give them a $25 gift voucher, we can stick with 10, I guess.
Lapine has had, what Alan, and we've had conversations with, I can't remember her name, the gal who does the diaper. Alan, who's the diaper lady? Is it April?
It's April, and this is Patty, by the way, and I'm on the line now.
She does the diabetes and obesity related stuff. But they launched it, what, a year ago, I think, the diaper program, and it's been, they didn't have hard numbers yet, but they've seen a difference, so it's.
You mean the diaper program is giving diapers for people that come in?
The voucher, yeah, for those who are pregnant, and it's been very successful, so. And it's a similar population, so.
So we have 70 kids visiting the clinic 5 times a year. That's what we have.
That's the dream.
That would be the dream, yeah.
So what we can do is we can just focus on the first coming year instead of 3 years.
Yeah, we went 3 years, being 0 to 36 months, but it's maybe not the best number of years.
That, what would be the best number?
I think we should still go to the 3 years, because if you don't, then you want your metrics goes to the 36 months.
Yeah.
Right.
If you replace that 3 with a 5, it'd be 3 years.
It's not the number of kids that's going up, it's the number of,
Well, you gotta track his
Encounters.
encounters.
yeah.
You're starting with 70 kids.
But then you just have to
But you're
reduce
seeing
it to
them 5
$10
times a year.
25 to 10, and then multiply that.
So you gotta do 70 times 5, and then that number times 3.
Yeah, so we'll have to do it to 15, but I don't think we.
Wait, no, 70 times 5 times 3, so, yeah.
So 17 to 15 would, I don't think we're gonna have funds for that.
7?
No, she said 70 times 5.
Times 5.
Times 5 times.
But we are still sticking with the, so 5 is per year, right?
That's how many visits you end up
Yeah,
with
but
in that
we-
3 years.
Yeah.
They
No,
added the
no,
3 years.
5 visits is 1 year, right?
Is it
Yeah,
1 year?
That is 1 year, so.
It's
is
1
that-
year,
okay.
it's 1 year. So it's 5 visits per year into 3 years if you're going that loud. So it'll
That's
be
what it
50,
is.
15. So I think that'll become,
So it's 350,
Well-
and then times 3.
can somebody do the math for me?
But look, you got 33, and you originally thought, you're talking about 11,000, so do you, I mean, what are you doing on contraceptives? Maybe you've got the money there.
Let's see the numbers, how much is 17 to 15?
I don't know, I don't have that.
That's got it over here in the,
Awesome.
1,050.
Nice and round number. And
so take
And
that
it
out to 10
$10,000, we gave $10, right? And that's
times 10.
so we can either do into, yeah, 10,000.
500.
So you're still in your
So
11,000.
that's.
Well, not, you gotta,
But Lapine
Yeah.
again, needs 27.
But
That
look,
makes it
it's in
1,300.
Deschutes County.
13,000.
But this is, these are the numbers
Oh,
specific
okay,
to.
okay, I see, okay. Well, maybe we take the money out of contraceptives. I don't have, what kind of program do we have for the contraceptives?
We haven't made it that far yet.
But you have to remember, not everyone is gonna come in.
Yeah. Yeah.
right.
So you're not actually gonna use that $13,000.
Yeah, you're right.
For the Lapine Clinic and
Yeah.
for South component.
The other thing that you guys can mess with when you're looking at the numbers is there is some, you know, not getting something on every visit is okay. I mean, there's, you know, a punch card that gets you to something and then you are awarded. It's the same mechanisms that stores use to get people to buy 10 sandwiches. You know, that's when you get the free one or whatever. You know, you can build up in little rewards as a third visit or a
Well, we
fifth.
have the toys from
Just-
Nora and
Oh,
Joe was gonna call you about
That's
doing
right.
some to you guys too. But they're toys,
Age appropriate, so you have.
so we could give them a toy and do a punch card, and if they do all of them too,
Then that's where they get the.
we could give maybe a $20 voucher.
Yeah.
That's a great idea.
Play with the budget, yeah.
So for now, if we stick with this is including Lapine, comes up to $13,200. I guess we'll have to visit with the government.
Yeah.
And the other thing, just to mention on that, Because if we're doing the screenings, we're not gonna reimburse it, right? Public health is in. The physician fee is there.
So the ASQs, if they're submitted to the physician gets reimbursed.
Because that's what counts for EOCC.
Yeah.
right? This one is just-
Yeah, so, right now, Thomas has like.
How do we fix that?
How do we do this?
Well, we need to talk about that, but I think that it would be appropriate.
But that's what we're here for. Tell us what you need.
Well, we're talking about like over 3 years.
The money would be, this is for, what, March is about when it's going to run, it's a 1 year.
It's a 1 year.
To change it. Yeah.
Well, I can do some figuring.
What? And before I forget to, since I've got so many people here, it's CHIP, right, that applies for these grants, that's where it's Lake Health District, because that's what houses CHIP. So Lake Health District is the fiscal agent, so everybody else who's involved in this project, the applications include a letter that everyone signs off on to saying, we will do this, this, and this, and we will do this, like, basically an MOU, but not an MOU, so that we have accountability on both ends, that you're getting the money that Lake Health District is responsible for going out, and you're doing the things that you're supposed to do, so nobody will forget that. Top of my hand, I'm sorry.
So it's really important that everybody, like what Beth's bringing up now, about looking at what happens on the front end. Anytime you're talking about grants, those people who are on the ground doing the front end work, it is vitally important that you speak up and tell those people who are trying to write the grant how it really needs to work, what works and what is required. Because if you don't, having seen this happen before, the grant writer tries to figure it out and they may be wrong, and then you're stuck with this list of things you're supposed to do and this is how you're supposed to do them, and you're like, wait, that doesn't work, that's not right. But if you don't speak up and tell them, they don't know. So please make sure that you tell them how it works and what you need so that they can get the figures right, because this is the time to solve all of those problems, not after the grant is there and you're stuck with a bunch of like bad fruit that you're like, I can't swallow this, I can't work with this. So this is the time, because the grant's due the 31st.
For the contraception incentive measure, all the costs that we could come up to were, speaking to Juanita, our clinical director, she said that staff trainings would be very beneficial because one of the main pieces of contraception is asking the one key questions to the patients, and she said in her experience a lot of MAs feel uncomfortable asking sensitive questions like that, so we could probably provide them with staff trainings where they could learn how to get across that barrier. So we added staff trainings for the contraception incentive measure, and we have 8 MAs. So Juanita has to get back to us she said she knows an organization that is gonna conduct trainings. Because we have a couple of organizations which are far off in Portland, and it's gonna cost a lot just for paying for their commute. So she said she'll get back on that, but we still have an idea where we need staff trainings and.
Which the time for those 8 MAs would be another in-kind.
Yeah, so we'll have to compensate them, but Juanita said that the clinic will take care of that. Yeah, so we're gonna train all of them together.
I do, I have an MA and an RN, but it seems like that training could take place in Lakeview where we have 10 of them that need to be trained.
Right, that's
Yeah.
either
It's really silly to.
a webinar,
Yeah.
like all in one place that we just not letting out. And it's what, you said an hour maybe at the one that you were at, that was
The
part
one
of
that
the
I-
larger.
Yeah, it was just part of another conference, but I don't know if you're uncomfortable asking that question, if you could be trained in an hour to do it though. I mean, seriously, because the people that the conference I was at, no one's uncomfortable
I
asking
was
that
just gonna say,
question.
maybe we could have
So-
Public Health come teach, I mean, seriously, you guys ask that all day, every day.
Yeah,
I mean, maybe,
Are you facing that problem at Water Mountain?
No, I have the RN from Public Health. And I have Lisa Cahill. Yeah, that question gets asked.
So I've never been to a training though on how
Yeah,
to do that, so I don't know, I mean, we wanna make sure that everything's being covered correctly, you know, how the process works.
Yeah, they
I
want
mean,
to
I
be
feel
covered
comfortable
next
with
year.
it, but
Yeah.
I don't know.
With those resources,
Yeah.
I haven't even had a chance to look at what was on that website. I wonder if those resources just give us enough to, I don't know.
I think the biggest concern is that people are afraid that when that question is asked, that somehow you're implying something. And by
That's why you
ask-
ask everybody.
And that's
then
why,
they're
that's
not-
right, and that's, so if you ensure that you're not putting it in a religious context so that no one is put off,
Right.
it's a pretty straightforward question that doesn't imply anything. Do you plan to get pregnant?
Now, do you plan to get pregnant? Would
Within
you
the-
like to
within the
become
next
pregnant
12
the
months.
next year?
Yeah.
If the
And,
answer is yes, great. If it's no, are you prepared or dealing with that appropriately? That's a reasonable question. If it's difficult to ask,
You're probably the wrong profession.
I tend to agree.
it's not a moral.
But it is
No.
but it is a workflow issue. It is,
Right.
I'm sure that train anticipates some reactions that maybe some of us aren't even thinking about right now and how to handle those. You know, it's no different than a police officer walking up to somebody who doesn't have their seatbelt on. I mean, they've got all kinds of different,
That's funny that you say that. I was just gonna say, I think
Strategies
the
that-
one right above it is, do you wear seatbelts? Fire extinguishers on the, you know, in the
Yeah.
house.
Yeah.
I mean, it's just all part of that.
asked that before.
it's just, you know,
Yeah, it's just all
people
part
have
of those
different,
questions.
and you, so you get, there's different answers to things that people
What's the one
say.
that you were saying is the, so you, if, you know, if you go either way, if you happy either way, is that the response you said? That's the
Well,
trick?
yeah, and that's what you get a lot of times is that ambiguous, oh, I don't care, you know, so you wanna get pregnant? No, not really. So you don't wanna be pregnant? Oh, I don't, it's fine.
I care.
At our last meeting, I shared half of births in all of Oregon, so everybody, not just the OCCO people, are unintended.
So the only answer you can say to that is, so if you're not preventing it, then you're planning to become pregnant, because you will if you're not preventing it. So then from there, I don't know, they still won't decide you.
You could answer that. I mean,
I do what?
you kind of answered that question, you know what I mean?
Well,
You
yeah,
choose not to
just-
decide, therefore you choose to accept the consequences of whatever occurs. Okay,
Well,
right? Only that doesn't
well,
always work
so
that way.
what, yeah, I mean, what that would do, but that, I mean, what you would do then is say, well, then it sounds like you need preconceptual counseling. Because you're choosing not to be on birth control, so you will become pregnant. So we'll tell you how to make that pregnancy healthy. And then when you start doing that, they might go, whoa, wait a minute. I mean, that's difficult for people that don't want to choose one way or the other, but I mean, if you can do that non-judgmentally at all, even if they don't want to decide at that visit, they may feel comfortable to come back sooner rather than later too. So there's a bunch of pieces to that, but no matter what, asking that question is gonna trigger more time on that visit, because if the answer is yes, then you have to set them up with birth control right then. If the answer is no, you have to do preconceptual counseling, and if the answer is I don't know, then tell them why you're giving them preconceptual counseling. So it does add more time to your visit, and I don't know if that's appropriate for the MA to do, or if it's appropriate for the doctor. I don't know.
Might be comfortable for the MA to ask that question and then say, fine, I'll refer that to your practitioner to address it. If it's an unclear answer, or if it, no, I don't plan to be pregnant.
It's a screening question.
It is a screening
And
question. It
MAs
comes
are,
right through on the
MAs
screening
are doing a
stuff.
bunch of screenings,
Exactly.
so, I mean,
And then
it's
the
not.
provider takes it from there.
Yeah.
anyway.
That way too, if it's coached in the middle of other screenings, it won't feel as if it's out there that you're going to focus on this and it might be a judgment.
So,
Well, that would be how each of the individual clinics handles any visits. That would be standard.
and if you're good at this, at asking this non-judgmental question and getting good buy-in, it might be a good idea to sit down with folks and say, what is it that's concerning you about asking this question? What's making you uncomfortable for the MAs if they're not comfortable asking the question? Maybe they're just concerned what the answers are gonna be. I don't know. Is it a time constraint? Is it what kind of, is it the fact that they've been asked themselves before and gotten, what, you plan on being pregnant? What, you want to get pregnant now? Which is what I got. It's like, no, birth control is none of your business. So maybe that they kind of experience themselves, but I don't know what it is that's, why on earth would you be uncomfortable? I don't know. You don't understand. I don't understand. They do.
Well, if you decide to home grow one and not bring something in from the outside, and you think role playing would be useful, let me know, because I think I can help with that.
We also put in some budget for the contraceptive devices and drugs. We'll be needing for this incentive measure. And
Is that a covered benefit?
I was gonna say, it is a covered benefit, so do we need money?
So why would we
in
put
there?
Well, I think when we wrote that down, I was just saying, you know, the trainings and all that, I said, remember that when they do the measure, it's about the device or the drug. That's how they count whether somebody is on effective contraception. It's not the counseling bit, it's the insertion of the IUD. You know, or it's the Depro, or it's the prescription for,
The ICD-10 code that you use.
yes,
for
that's
that
when they're
contraceptive
counting.
measure.
So that's what I meant when you wrote that down,
Yeah.
because
Is it-
asking the one key question, that doesn't get you, you know, that's
It's
just,
providing the device.
yes, that's what counts.
Only something new, like if somebody's already on using some method.
No, they can go back and you can document.
There's a
it.
question, there's an
Yeah.
ICD-10 for that.
Yep,
So the device and drugs is really not something you're gonna ask for extra money?
no, you wouldn't.
But you need the training to ask the questions so you can get to the conversation about the
To get to the
contraception, so
device.
that if they need
So you
something,
can code
you
it,
get them.
then you get credit for it.
But then clinics need to have it available.
And is that a big extra cost? No, that's not, that's something that's covered, yeah.
Well, I'm saying they should go out of the office with one in hand, one pack of pills, or their Depo shot, or
We can't have it available. We have to write the prescription for it, they go get it.
you can't have a sample to give.
They don't sample that anymore to us.
That's what I'm saying, would that be appropriate to buy some?
Like,
And say
it's
you're
all
giving it as a
100,
sample?
it's covered 100% through the pharmacy.
And then that
As
gives
a
them a
benefit
chance to
of
think
theirs.
about it, and have, you know,
But will that work if they leave a prescription, Paul?
They could,
Yeah,
yeah,
it's
I
code-
mean,
it's all on the ICD-10.
but that prescription, if they don't fill it,
Bill it.
it doesn't count as a bill.
It
So they can
doesn't
say, no, I
no,
mean,
it doesn't.
they can say, we wrote a prescription for oral contraceptives and handed it off. Until that person
Fulfills it.
fills that prescription, then there's no code that says that they actually
So even if we give them
got
a
the
sample.
drug. Now, that doesn't mean that they don't take it appropriately either, so.
I thought they counted them by the ICD-10 code that stuck on it, that as well as the pharmacy.
Yeah, it has to match up.
Okay, that makes sense.
There's lots of research on starting someone on a birth control method in the provider's office, having them take that pill right in front of you or give that Depo shot right then. It's there's a lot of evidence that they're more willing to continue on that method and.
We do the Depo shots because we write a prescription, they
Yeah.
go get it, they bring it back, we give it. But the pills, they just write a prescription, they don't pick it up.
Okay, well,
And it
if
doesn't
they'll
help if
they'll
they take
get it,
them all at
they'll get the
once.
shot right there without going to the pharmacy. They'll get the pills right there.
Once every week.
Yeah, do that.
It is interesting.
So what do we need to do, Arvin? Because we've got 5 minutes left.
we need to discuss the advertising right now.
And do you have enough information to finish what you need to? Is everybody here know that they need to get to you guys to finish this before the 31st? You have 5 minutes. Does everybody here know what they need to do to make sure that they give you what you need to finish this?
Reimbursement for public health.
Yeah.
A link with food for, Sky Lakes.
Right, we got that.
We also haven't talked about the opt-in measures that we're gonna try
Let's talk
for.
about that quickly then.
And that's a piece to, the health fair is the one that we've talked about most extensively in here, duplicating what they did in Baker County. And just in a quick nutshell, I was confused the first time we talked about it, so I talked with Baker County and got kind of rundown. They got St. Luke's and St. Alban's providers there, they got the providers to agree, we won't do just the sports physicals, we'll do this total fair, so that the kids going through got a more complete look. They had a passport to health, they opened a clinic 3 nights, it was Wednesday, Thursday, Friday, from 4 to 7. And the kids with their passport to health stopped at one stop, they had immunization, made sure they were all up to date there. They stopped somewhere else, they had the mental health check. They stopped somewhere else, they got the dental sealants, I think it was. They stopped somewhere. The last stop is the provider, the actual provider who can do the physical, who can look over everything else, make sure that nothing got missed. And everybody, the kids, if they got everything checked off on their passport, then they got a prize, and it was a movie pass. And then they were entered into a drawing to win a bike. So that was the incentive to get the kids there. So that's one thing that we need to talk about, the incentives and what we might offer. And then I guess we can talk individually to anybody who would be providing a clinic. And we need time, that's the other piece. We're pitching for that one to do 2 dates, one down in Lakeview and someone in Tornell, possibly tying it into daily days, or possibly tying it into school registration.
Sports physicals are typically done in the spring.
In the spring, and so that's the other thing, I just talked to Will before he left, we're hoping to talk to him and to Bobby too, just to make sure, since this has been Bobby's baby, sports physicals for so long. And her kids, whatever that, what is that class, the class?
Student trainer.
Yeah,
Athletic
they
trainer.
take the UAs and they take blood pressure, and so if they can be involved to have that, so that, we're trying to cut that. We kind of think about that experience, so maybe the good is the time to do it, since it's closer to the, I don't know. But we need a date, and we need ideas for incentives, and then after this meeting, talk to people individually about what we would need, what a budget would look like, how to provide, what punishment would provide. The other incentive, and I didn't know this until today, so I apologize to everyone, we don't have to choose just one opt-in program, so Ken's not here, and we haven't come up with a sexy new name for colorectal cancer, but there is an opt-in program for that too. And it deals specifically with the clinic, and maybe you can give us a quick rundown of what the program, I haven't even looked at it.
A third-party vendor works with the clinic, uses your letterhead, signatures, identifies who the people are that need the fecal blood tests, and then sends it out under your name. You have an agreement with them, and they collect it up and see what it goes. I mean, it's kind of hands-off. It'd be some time for the clinic is what you'd be building into the budget.
It's a demographic we haven't really talked about, who desperately need those numbers to be approved, so. And a sexy new name.
We attempted voluntary screening for people to come up and pick up a kit, even some incentive through the senior navigator programs, like, people would do it. They would not come. If they're available to clinics, they were available to public health, and no one would pick up a kit. It was astounding.
So the diabetes program, we still need to find how much the cost is gonna be for fancy. And for the developmental screening, the public health department can give us an idea how much the reimbursement will be. So.
That's next. What else next? Can we ask about promotional ideas too? So whatever leftover dollars, it's kind of hope is that we can kind of start pouring it into Outback Strong, which tie in those two things to Outback Strong as well. So if we can have a good size advertising type budget, promotional budget. And I don't know, I talked with Holloway's just to get kind of a sense of what they charge for flyers, for posters, that kind of thing. But then we mentioned t-shirts, I don't know, are wristbands a thing? Hip young kids, what's cool, what do we need?
Well, I was wondering, I don't know what type of budget you're talking about dealing with, but if you're really looking at branding well, and having like hiring an agency to do it, like I'm providing these templates, it's just a thought, I don't know what the budget looks like. So it's not necessarily being done in-house. if this is something we're gonna use for a lot of different
For
things,
anything.
it would be probably worth it, I think.
And I think we have to, if you're gonna do it, it has to include some social media
Yeah.
campaign. And I don't know if a person needs some dedicated hours to work on that. And probably English and Spanish, not just Facebook and Twitter and Instagram too.
I think if we have stuff going on, it is easier to be interactive on those, but we have been talking a lot about how the trends are, and I keep track of those and I send them on, and, you know, what are the trends in social media, and what is working, and what is clearly not working, but people don't necessarily know that because they're not up on it, so, yeah, I agree. We have to find out what's really will be interactive and find stories, find a way to tell the story and engage people, because that's what does it.
I think we'll have a good $5,000 to $6,000 for our professional fees. Okay, so
Do you feel ready to have enough information to gather for the grant application?
We have a really good start, especially for this one. That said,
Yeah, the other ones do. Same.
they're all due on
They're all due.
first, so I will be stopping people, just be aware.
Well, just a couple of quick ideas about the promotional incentives for the team and the youth thing. Instead of movie passes, maybe swim passes, if it makes sense in the summer, and encouraging that activity based. And I also do like the idea of the bike for a big prize, because that's physical activity too, so.
You could also have the smash party, or the drive, during the rodeo roundup.
I mean, Beth and I are looking at each other like, oh gosh, how do you fit one more thing during fair? Who's gonna manage that? The physicians being available.
No, I mean, win a ticket.
Oh, to wait.
Oh, to the demolition derby.
Yeah. If you're gonna give that as an incentive, a lot of kids really like, they're not going to a movie.
I panicked.
No. They're thinking about incentives.
Jenny.
And don't forget, if you have somebody in your group that your idea is that you can put your stuff under this umbrella as well. This is, right?
Yeah.
This is like, that's why Beth came up with the wait, you know, you could put any immunization or any, whatever was going on with your thing, and if it had health, you know, you could put it underneath that umbrella.
I'm sure if we could ask the roundup,
That's a burn it.
or a concert pass.
Who's the headliner?
The
Who's
old
the-
time fiddlers. I'm just kidding.
Okay, so those are really good incentives.
I heard the Doors were coming, the next community
So-
concert is gonna be the Doors, I heard.
Oh, wow.
Okay, do we, thank you, our vendor. Do we have any other issues we need to bring before the group? Are there any comments that anyone wants to make on behalf of their organization? You have something, I take it.
Just one short. I've got more pens in case anyone needs to press into the hands of potential domestic violence victims. These are easy, and they also have stylus on the end. These might be easier placed with men. We had some difficulty placing less proof looking pens with men. So anyway, so in case you all are out there and think that somebody really needs a pen, no honey, you really need a pen. 1 in 7 men, 1 in 7 of our clients is male. So if you think there's somebody in trouble and they aren't ready to admit to it yet, maybe they'll get twist.
Thank you. Did you want to say anything about this?
Sure. So every year, class does a homeless count in Oregon. That's just when it's taken the census. And it's at the senior center. I gave most of you a flyer. If you could post one, we're gonna have them just everywhere. But if they just show up and you don't even really need a name or just a, last year, I think there was one person, I know there was one person who'd been here before. So it's not something that people are rushing to the door to talk about, or, you know, it's not an easy conversation, but if they're counted, it's very important that they're counted, because then Lake County is looked at differently and will get money to help. Because you know there are so many people sleeping on couches and.
So I was wondering about that, could we put couch surfing instead of sleeping in transitional? Isn't that how, don't know what that means?
That's how it read last year. And these were the ones that I listened this time. so.
You're right, that's on the picture of homelessness in frontier counties, it's sofa surfing. People understand that. A lot of kids I've heard them sleep at home appliances, that's homelessness, it's just not the way we
Right.
do things.
Well, we can add sofa surfing on our own flyers. Thank you, we'll try to. Any other comments?
Just on that, I think the school districts are supposed to make account of those. So,
And Head Start. You talked to Vicki though the other day, right? Because Head Start makes
I
it count.
did.
Oh, you did?
but I mean, schools do as well.
Yeah, they do.
That's part of the Department of Education requirements, but, I mean, you get an idea of how many kids are transitionally couch surfing. But, because I mean, I think we did see like a really bad number. I mean, it was so small, it was inconsequential on one of the reports that we looked at for homelessness.
And I'm just talking, the one
Yeah.
is the one that showed up at the senior center.
Right, okay.
So in Lake County, I'm sure the numbers were higher, but.
Right. And this is happening all across the state right now, this month. I've seen the other CACs dealing with it as well.
Thank you, everyone. I'm sorry we went a little bit over time, but it's been very good discussion. Our next meeting is going to be on February,
9, I think.
is that the date, February 9? I believe that's correct. Is that correct?
Yes, it's February 9th.
That's the night, yeah. So February
Yes.
9, 3 o'clock. Thank you, everyone.
Everything.
Have a great rest of your day.
Thank you.